We have with us Dr. Janice Howes. I'm very pleased to have her here. She's a psychologist with the Nova Scotia Health Authority, and she's also the psychosocial oncology clinical lead for Cancer Care in Nova Scotia, and she will be speaking about cancer-related worry and anxiety, which we all know about. Dr. Howe?
So thank you for that introduction, and thank you for inviting me to present today and to be part of this Kidney Cancer Canada event. In my practice as a psychologist, I frequently deal with individuals dealing with cancer-related worry and anxiety. What I'd like to do today is to provide you a brief overview, and it's brief because we do have time limits here, about cancer-related worry and anxiety, with some focus on scan anxiety and worries about recurrence, because those are such significant issues for people dealing with cancer and those dealing with kidney cancer. And then I also want to take a little bit of time to briefly discuss some helpful coping strategies that you may find useful. These are two quotes from individuals with cancer who are experiencing cancer-related worry and anxiety and may resonate with you. The first is, "Everyone tells me how well I'm handling this. Inside, though, I feel scared and worried." And the second is, "Every time I feel an ache or pain, I'm afraid the cancer is back. Sometimes I feel panicky." And that ties in so well with the fears around recurrence and progression of disease. I want to highlight that cancer affects more than your body. Just as Dr. Wood indicated too, it is really important for us in healthcare to be more focused on a more holistic approach to cancer care and to caring for individuals and offering treatment to individuals with cancer. The physical impact of cancer, you're all very well aware of, but there's also practical, there's informational impact, spiritual, social and family, and psychological, in addition to emotional. The social and family, I did want to just highlight very briefly for today, just to indicate that cancer also affects the family, it affects close friends, and it also affects people that care for you. So it's a disease that ripples outwards and doesn't just affect the individual in isolation. From an emotional point of view, today's focus is on worry and anxiety, but there's many different emotional reactions to cancer, and I'm sure if everybody spoke about how they felt at different points during your experience with kidney cancer, that would resonate throughout the room. Sadness, grief, sense of guilt sometimes, depression, irritability, anger, frustration, in addition to worry, fears, and anxiety are all ones that we see. So what is anxiety? It's worry, it's fear, it's uneasiness. It can be nervousness, a sense of dread, or a sense of panic. And what we do see with anxious feelings and with worry, that sad feelings also accompany that, but the anxiousness or the worry may be stronger. Anxiety can range from very mild feelings of worry to almost paralyzing fear and worry. So it can really significantly impact your everyday functioning and your life. We know that 18% of the general population experiences anxiety, so it's quite common. But let's look at that with respect to cancer. We know that for many people with cancer, feelings of anxiety and worry come and go and don't lead to any significant difficulties. And so there's no difficulties with their everyday functioning. And really, when you think about the stress associated with cancer and the uncertainty with cancer, really having some fear and worry and anxiety about it is quite understandable and normal. We also see that emotional resiliency or strength is something that is quite common in those dealing with cancer. At the same time, 35 to 45% of individuals that are dealing with cancer will experience what I, as a psychologist, would regard as significant distress at some point in their cancer journey. It may not be at the initial time of diagnosis, it may not be at the time of recurrence or the end of active treatment, or in progression of disease or advanced disease, but at some point. And we know that high levels of worry and anxiety can interfere with one's ability to cope with cancer, it can interfere with your cancer treatment, and it can also interfere with your everyday functioning and lead to decreased quality of life. So there's a lot of reasons why you'd want to be looking at that and getting some help with it. Now, there's many factors that affect cancer-related anxiety, and on the slide, several are listed. The first one is diagnosis of cancer. So when you're diagnosed with kidney cancer, that's frightening, that's stressful. Dealing with treatment and side effects of treatment is very difficult. There's a great sense of vulnerability, a lot of uncertainty, and a lot of people, when they're dealing with cancer, have this intense sense of loss of sense of control or agency over their life. It's like you're not driving your own bus any longer, and that's very difficult. In addition to that, we see that misinformation about cancer and prognosis is quite a significant factor in leading to cancer-related worry and anxiety. So many of us are often encouraging individuals to talk with their healthcare providers about their questions, about their diagnosis, get the information that you need in terms of understanding your disease and your prognosis and your treatment. Because misinformation, we often jump to negative conclusions and can create a lot of stress. Having advanced cancer also adds to cancer-related worry and anxiety. And unrelieved physical symptoms or other symptoms that you may experience related to cancer or cancer treatment. So difficulties with pain, difficulties with cancer-related fatigue, nausea, vomiting, all of those kinds of things will add to the experience of cancer-related anxiety and worry if you don't have a clear understanding of where those symptoms are coming from and what they mean. Ongoing cancer monitoring, which we'll talk a little bit more about, is very stressful, as all of you know. In the days or weeks leading up to the scan, in terms of your scheduled follow-up, worry and anxiety starts to increase for many people. During the period where you have to wait from the time of your scan to when you get results, that can be a very anxiety-provoking time for people. And there's some strategies you can use to help cope with that, but that is difficult. But that ongoing cancer monitoring is at the same time so important in terms of your oncologists and your cancer doctors in terms of managing the disease. So it's a difficult situation. There's also a lot of life adjustments related to cancer that can contribute to worry and anxiety. And if you are somebody that had prior problems with depression or anxiety prior to your diagnosis of cancer, you are more likely to have difficulties in this area. Changes in supports. Many people have somebody in their life that they thought they could really count on for support or to be there for them during the experience with cancer, and hopefully they have some people that have followed through. But there's always usually one or two that you thought would be there but haven't really been there. So some of those loss of supports can be difficult. And other life stressors. All of us have other things going on in our lives, whether it's work-related situations, marital issues, caring for an elderly, ill parent, kids, all kinds of things. So those other stressors also compound. Now, cancer-related anxiety can occur really at any point in the cancer experience, and we've already touched on that a bit in the slide before. Transition points are particularly stressful times for most people, and I think that Brian did just a superb job in articulating some of the emotion at the time that you receive that diagnosis from your surgeon in terms of recurrence. But it's a very stressful time, lots of transitions, whether it even be at the end of active treatment and you're moving forward, time of recurrence, dealing with advanced disease, and so on. Cancer-related worry and anxiety does not occur by itself. These are 5 difficulties that are quite common and that individuals dealing with cancer experience. Cancer-related worry and anxiety I've put at the center for the purpose of this talk, but they all interrelate very much. And they do affect one another. If you're dealing with cancer-related fatigue, that is very difficult. And if you're dealing with cancer-related fatigue, your energy is down, you're very tired, you're not able to do a lot of the usual things that you would like to do or enjoy doing. And that can lead to or contribute to some of the worry and anxiety. If you're having sleep difficulties, which many people do have when they're dealing with cancer, that also makes it much more difficult to cope physically with the disease, but it makes it more difficult to cope emotionally with the disease as well and with the effects of treatment, so that that can become difficult. And depression and pain are also significant within this relationship. So what are the signs of anxiety to watch out for? So persistent worry and fears, so ones that really stay with you, not the ones that so much kind of come and go and aren't causing significant difficulty. If you're feeling nervous, if you're feeling panicky and feeling very overwhelmed, those are significant. Feeling irritable, frustrated, and angry, and most of us do feel that way to some degree when we're dealing with stress. Feeling restless and having difficulty sitting still and not really being able to relax. And we also see that with cancer-related worry and anxiety, it can affect your concentration and your memory, so you're more forgetful. Some of the other symptoms are more physical or physiological in the sense of muscle tension, increased heart rate. You may sweat more. You may get kind of shaky. You may feel kind of numb or dizzy at times. Your breathing may change and become faster and more shallow, so you're breathing from up here as opposed to your diaphragm. You may have some GI difficulties like nausea and diarrhea, and sleep difficulties. And sleep difficulties, if you're dealing with cancer-related worry and anxiety, and it is quite significant, is that you'll get less sleep. Usually that's what happens when you're dealing with worry and anxiety. And one of the things is, and I think all of us can relate to nights when you're lying in bed and the house or the apartment is quiet and you're not very sleepy, and then your mind starts racing. And all the worries and concerns kind of come up, and you just go from one issue or concern to the next. So sleep difficulties is significant, and then that also makes it more difficult the next day to cope with the emotional and the physical side of what you're dealing with. So there's several specific cancer-related worries that people experience, but I'm only going to focus on these 2 given our time today. And the 2 specific cancer-related worries, which are both interrelated, are worries about medical tests and results, and worries and fears of cancer recurrence and progression. These are really understandable worries that people experience when dealing with cancer. So it is normal that you would have these worries. It's a matter of how you manage them that becomes very important. In terms of scan anxiety, I wanted to talk a little bit about it. So this is the anxiety that is associated with the ongoing monitoring of your health situation and checking out what the status of the cancer is. So this is the time leading up to the scan, the CT scan, during the CT scan, and the time between the CT scan and when you get results from your oncologist. And for those dealing with metastatic kidney cancer, you may be having a CT scan every 3 months or so. For those of you that are dealing with more localized disease and early stage, your scans are much more spaced out. But you're still dealing with the same thing. Every time you have a scan, it's that close internal look as to what's going on and gives much more information both to you and to your cancer doctor. All right, so what I wanted to say also about it is that the ongoing stress associated with this cycle is difficult to cope with, but it's also very important in managing the cancer. It does affect your daily life, and often people talk about their ability to plan. They plan based on their follow-up schedule and their CT scan schedule. So if the CT scan is stable or looks pretty good and they wanted to go away on a trip, then they try to get that in, if they're medically stable to go, before they are close to the next scan and so on. And it's difficult to plan beyond that. And if you're somebody that's a planner and you've always planned your life in 5 and 10-year blocks, that's a pretty significant adjustment when you're dealing with cancer. Also, there's the ongoing adjustments of these periods of stability and where things are calmer, and then they're punctuated by periods of increased anxiety and worry. And it's the ongoing dealing with the uncertainty and the sense of vulnerability. For many people, that follow-up cycle can feel like an emotional roller coaster because you are punctuated by those periods of ups and downs. So I'm going to briefly focus on coping with cancer-related anxiety. There's many strategies that you can use to help manage cancer-related anxiety, and I'm sure many of you are using some very good strategies at present. But here's some other things to think about and maybe some ideas that you hadn't thought about. One of the first ones is it seems pretty obvious, but many of us don't do a very good job of taking care of ourselves. And if you do work on taking better care of yourself, that can be very helpful in terms of managing cancer-related worry and anxiety, and can be empowering for you, and then can help you deal with worry about cancer recurrence and that ongoing anxiety that happens around the time of scans. So place yourself as a higher priority, and if that's difficult for you, you may have to work on giving yourself permission to do that, but that's got to come from you. Healthy eating, and Dr. Wood alluded to that earlier in terms of what's defined by that. Talking to a dietitian can be helpful in terms of just identifying some basic healthy patterns. And I know that there are some things with kidney cancer, depending on the health of your remaining kidney, that you do have to watch in terms of the amount of protein, limited salt, and alcohol that you have to watch, in addition to all the water that you need to drink. Get enough rest. Pace your activities. It's really easy for us to try to go at activities in the way that we've always have, but you really need to listen to the feedback from your body and pace as much as you can. Physical activity, given the limited time constraints, I wasn't really going to talk about that today, but I just will throw it in because I think the booklet that Kidney Cancer Canada has done is just great, and that's important to attend to. So here are some brief tips to help cope with scan anxiety. So one of the things that you can do is request of your physician that your scans occur early in the day so that you're not having a scan later in the day and you've been awake and worried about it all day. Have a family member or friend go with you to your appointment, but go with your best supports. Think about who you can really count on in terms of being a support. Use distraction and coping, self-talk and relaxation, and I'm going to touch briefly on that. A real key, I think, is know when and how you will get the results. So ask to receive the results as soon as possible after the scan that you can, and you may need to talk with your healthcare team about your anxiety, about the upcoming CT scan. So really important to communicate. In terms of distraction as a strategy, focus on things you enjoy and that are relaxing for you and that will distract you from the worries and the anxiety leading up to a scan. So read, but if you're going to read something that's really interesting for you. Don't try to read something you're really not into, because that won't do it. Listen to music you enjoy, see a good friend, watch a funny television show, see a movie. Humor can be very helpful, but keep busy. In terms of relaxation, there's many different ways to relax. Does anybody use any relaxation strategies on a regular basis? No? Okay, all right. But this is something that you could do, but you maybe have your own strategy. Some people use music, some people listen to nature sounds, and so on. But there are some relaxation strategies that you can learn that can be really effective once you're practiced with them. There's lots of those that you can learn. So slow, deep breathing, relaxation, imagery, massage people. A number of people find massage very helpful. And nature, just being out in nature, there's lots of studies looking at that in terms of being out in nature and the value of that in terms of our physical well-being, but also our emotional well-being. I'm going to quickly give a very basic summary of this. One of the things that we know is that there's thought and feeling cycles that we deal with. This is a super simplistic version of that. There's many, many other factors that affect this, but I don't have time to get into it. But the basic idea is that when you have anxious thoughts and feelings, or anxious thoughts, or negative thoughts, or upsetting thoughts, that's going to cycle down and contribute to anxious feelings, both physiologically, but also emotionally and psychologically. And then as that increases, that's going to contribute to your anxious thoughts, and the cycle goes on. So one way to modify that is to work on modifying anxious thoughts and feelings by trying to break that cycle. So this time we want to break, B-R-E-A-K, the cycle, as opposed to the other break. So we want to break that cycle and reduce and manage the anxiety. So one of the ways to do that is to challenge worries. And if you're going to challenge a worry, you want to look for the evidence for the worry, the evidence supporting the worry, but you also want to look at the evidence against the worry. And if you sit down and do that, that will be helpful. Another thing you want to do is you want to work on being more present-focused and being more in the present, in the day. We all have a tendency to telescope into the future in a negative way and not do so well about focusing on what we're doing right now in the day. We definitely have today. We don't know what's going to happen tomorrow. So the more you focus on the day, the better that can be. So that's another strategy that you can use. I'll just go through a very brief thought record, and I'll just read this because it may be difficult to read. This is a helpful strategy. If you're having a worry that's really just hanging on and you're having difficulty dealing with it, this is a useful exercise. So you write down the situation, the anxious thoughts and worries, the feelings and emotions, and then the evidence not supporting the anxious thoughts, and then you reframe or your coping thoughts. So the situation here is, I had a CT scan 2 days ago and waiting for the results. The anxious thoughts and worries are, I worry that cancer has spread and there will be no more treatment offered. The feelings and emotions are understandably fearful, scared, worried, stressed, and sad. The evidence not supporting the anxious thought for this individual when she sat and thought about it was, I'm feeling good physically. Just before I was diagnosed with cancer, I had pain and was very tired, but these are not problems now. My doctor also said there are other possible therapies. So the coping thought is, based on that evidence, the waiting is tough, but I'm trying to take a wait-and-see attitude. It's okay to feel worried, but don't let the worry take over. The worry will not change the results. I can handle this. I've done it before. It's easy to write this down, to actually do it is more difficult. But I think that if you work at some of these strategies, it can be very helpful. And I see a lot of people in my practice where they really work on some active coping strategies that help. If your anxiety and worry is increasing, is very strong, it lasts for a long time, it's interfering with your daily life and functioning, and it's really affecting your ability to cope with cancer and treatment, then you should ask for help. So those are some of the things to watch out for. And if you're struggling with worries and anxiety, talk to your oncologist, talk to your cancer doctor, talk to your family physician, whoever you're seeing, and they may refer you to another member of their healthcare team, like myself or one of my other colleagues in psychosocial area, either at the cancer center or in a clinic close to you or in your home community for some help in dealing with this. The other thing I just wanted to mention is that if you would like more information about coping with cancer-related worry and anxiety, consider attending the Taking Control of Your Cancer-Related Worry and Anxiety psychoeducation session. There's 4 psychoeducation sessions that we've recently developed in the last several months, and I do want to acknowledge support from Health Canada through the Canadian Partnership Against Cancer for the support in developing these. They're each 2 hours long, and patients and family members who attend are finding them super helpful. In the anxiety and worry, if you haven't tried a relaxation strategy, I always do include an experiential component in that and do some relaxation. So think about that, and I'll make sure there's some flyers or the dates, Karen, I can pass on to you. We are doing them live at the QE2 right now, but we have just recently been approved for telehealth. And so we're in the process of arranging for them to also be telehealth to Cape Breton Cancer Center and PEI Cancer Treatment Center. And we're also recording them a briefer version for online use or for DVD for people who can't get in. So that's just another resource to keep in mind. And I think that's my end of it for now.